My patient is AD, a 36-year-old female who is from Peoria, Illinois, and Caucasian. I obtained this information from the patient itself, from observation, and her immunization records. She is married, currently employed as a registered nurse at OSF. Weight 145 pounds, 5'7", BMI of 22.7, which is ideal. Her temperature 98.8, temporal, pulse is 70, respirations 12, blood pressure 114/68, and oxygen saturation at 98%. Her pain scale was measured numerically from the 1 to 10, and she is rating her pain at 0 of 10. She does not have a chief complaint at this time, is just seeking a wellness visit. Her past medical history includes migraines, cluster headaches. She did have cancer of her upper palate about 8 years ago and occasionally suffers from insomnia. Her last physical exam was November of 2014. Her last dental exam was November of 2016, and the last time she went to the eye doctor was August 2016. She's unsure of her last hearing screen. Her last ECG was in June of 2005. She was having some chest pains, and it turned out to be more related to anxiety. Her last TB skin test was August of last year, and she's never had a chest x-ray. Childhood history includes she's had a broken arm and received stitches in her chin from falling off of her bike. As far as chronic illnesses, it's just that history of mouth cancer, nothing chronically happening today, and no acute complaints. Her past surgical history includes in June of '99, she had palate reconstruction due to that mouth cancer at Methodist Hospital, and it is since resolved, and she's in remission and has had no issues with that. Culturally, she identifies with Caucasian. Her habits that may affect her health is she currently smokes, she drinks alcohol socially, and recently has started to use a vapor instead of smoking. Does have some interest in smoking cessation. She makes decisions for herself and her household. As far as her spiritual assessment, AD considers herself spiritual and religious. She does believe in God and forgiveness, and when she's under stress, she prays. She does not feel that her spirituality has much influence on her healthcare decisions. She is a part of a church, and she has support through family and friends. And as far as today, she does not feel that her spiritual beliefs have any effect regarding healthcare decisions. Her Erickson stage is intimacy versus isolation. She identifies herself as intimate at this point. She's married, has work connections, and has an established career and work commitments. She rates her overall health as a 3. In the past 30 days has felt that she's only felt unwell about 2 days, mostly due to these occasional headaches. In the past 30 days, her stress, depression, emotional issues, she rates it about a 4. I feel pretty good most of the time. She states that she can be irritable at some points, but she works 3rd shift and her sleep is sporadic and inconsistent, so she thinks that maybe some of the irritability is due to lack of sleep. How many days in the past 30 has your mental or physical health prevented you from doing usual activities? 2, very rare. She can typically go day to day and not have any major difficulties.